Hello, everyone. I hope you are all doing well. Assalamu alaikum. How are you? This is a new session, free session, a long time from hold. We are going to discuss tonight the changes of. I hope you are hearing me well. Please write in chat if you can hear me well. Thank you. Um, we are going to start this session tonight. It's an important one because there is a lot of changes happened in the FRCR2b exam, and we are going to take time, in fact, to understand this new system, and to have the time also to review the sample cases they provide for short year exam, and to ask a lot of questions about this. And we are here today, tonight, to discuss this with you, try to establish this and understand what is going on. And will allow you to know how to prepare for the exam, how to start your journey. Today, me, Dr. Saidi, I am Dr. Mohammed Amin, by the way. Dr. Mahmoud Saidi will be with us as well, and Dr. Mahmoud Rizq also will be with us to discuss all things about this new system. Dr. Saidi will start with you discussing the short reporting exam, and how to prepare for this, and the style of the question. After that, I will discuss with you the whole changes from the website of the Royal College, and also I'm going to discuss with you the scoring system, which is a very important item. Will allow you to understand how to prepare for the exam. And then Dr. Mahmoud Rizq will give you an advices by the end of the session how to make this changes in your side. So, Dr. Saidi, I think you are here. Hello.
Yes, hello.
How are you?
Hi. Assalamu alaikum wa rahmatullah.
You can
I'm so
change your name. Everyone can.
Mhm.
Okay.
You can hear me?
Yes, 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 yes.
Okay.
You can.
I'm so happy to be with you again for this short lecture about the new changes introduced to the FRCR2b exam that will be held on this June. Everyone really has many questions about the changes. Even the one who is applying for the next exam, the information is a little bit so little. Until now, we have only this introduction from the Royal College itself on the website, and I really advise everyone to go through these small articles that the Royal College put it on the website. Also, they put a small video for 1 hour, I think, talking about the changes, the scoring system, and the new short reporting exam. They also put some cases on the demo. I will also share it with you. Yeah, this one. uh, like 5 or 6 cases only, like a demo for the new short reporting exam. Also, it is a good habit to try to see what is going on by yourself. I have a small presentation, and I want to share it with you about the scoring system. Yeah. The core of the exam is still the same. You have Viva, you have long reporting, and you have short reporting. The new system will be 3 parts only, 3 marks. Viva as a whole, and long reporting and short reporting. And in order to pass, at least you must pass in 2 parts, like long and short, long and Viva, short and Viva. Any mix of this make it the least requirement for to get the pass score. For the longer reporting, it is the same 6 cases in 75 minutes, but the scoring system has changed. And in my opinion, it is changing to be better, to give better chances to the candidates and to give equity also. The new thing they put it in the scoring sheet is the mark 0. Before there was no mark 0. The least mark that you can get is 4, but now you can get mark 0 if you didn't solve the case from the beginning. You have a shortage in the time and you didn't reach the last case in the exam, so you will get 0 in it. Another thing that they put a more clarified details about the scoring itself. So in order to get the full mark for in the case, you must mention all the major findings and you must reach the correct diagnosis, and you must write or give a detailed management, the detailed management, not only referral, not only next step, next imaging modality. No, they want a detailed management about everything in the case. And you may demonstrate knowledge beyond the core curriculum of the case, that you may show differential diagnosis, and you may add some details that why you didn't choose the differential diagnosis in the main diagnosis. You may add some details in the interpretation, like that. 4 from 5 is not far away, but if you didn't give the detailed management, if you put a narrow differential diagnosis like that, you will get 4. I think most of the candidates can get 4 easily if you put the major findings and the good interpretation and the correct diagnosis. You can easily get 4. For the Mark 3 is if you didn't get the correct diagnosis. Even if you put it in the differential diagnosis, you will get 3, not higher than 3. And this is also another change, that in order to get 4 or 5 in the case, you must get the correct diagnosis as baseline. And this is another thing that you take care of it. For the 2 and 1, I don't think that there is that you are missing a lot of findings, a lot of major findings itself. In the short reporting, it is the same scheme. For your information also, they are using the same scheme. You have the new short reporting will be 25 cases. There will not be any normal cases. They are all abnormal cases. They are all containing pathologies or abnormalities, and they will use the same scoring sheet. But the difference is that you will give a very short report, and they put some examples on the website about how would be the answers, the model answers for the short report. But it will be the same. If you miss any major findings, you will never get 4 or 5. If you will not diagnose the case, you will never get above 3. So take care of this, because the short reporting, the changes is easier in one aspect but more difficult in another aspect. It is easier in the aspect of there will not be normal cases, so you will not do any overcalling, and this was a tough part in the exam. Also easier in the manner of time. You have, I think, 2 hours for the 25 cases. So at least you have 4.5 minutes for each case, and this is a good time to see the X-ray. It is only an X-ray, 1 or 2 views. So it is a very good time and acceptable time. In the former rapid reporting, it was only 1 minute for the X-ray. So now you have more time, and you don't have any normals, so you will not do any overcalls. So these 2 points are positive things that in the change. But the negative thing, in my opinion, in the change is that the exam time itself is more, so you'll get be more tired, more exhausted, more liable to decreased concentration and this kind of stuff in the exam situation. And also the other thing that you must give a good short report. You must mention the positives and you must include the important negatives. And we will see examples for that. Like if the patient has pneumothorax, so you will provide an important negative is there is no tension pneumothorax or no fractures or no associated red flags. Also in a case of pneumonia, in a case of a fracture of a bone, you must include that there is a dislocation of the joint also or not. And like that, you must include some important negatives. And then you will put the diagnosis. And if there is any differential diagnosis, especially in the chest X-ray, sometimes you have one or two possibilities for the finding and the management. So the challenge part in the short reporting that you must include all the headings, the findings, the diagnosis, differential diagnosis, and the management. The findings include positive and the negative things. So overall, to be able to do good in this exam, you must be good in radiology. You must be good in the plain radiographs. This is another point. The preparation must include two steps. The first step is to be good in plain radiographs first. You know the science, you know the anatomy, you know everything, and then apply this information in the exam situation. Like you must practice the cases. You must practice as many exams as you need. So it is two parts in the preparation, and you must be good first in the plain radiographs. We have a lot of videos on our YouTube channel, Redmi Radiology. You can go through them first and then apply this knowledge on the exams. Dr. Amin will speak to you or will show you our website also. There is a exam sample and it is free and it is answered. So it is a good chance also to practice. Let me show you some cases from the RCR website. See, this is a case. You have 4 or 5 minutes for a case like that. There is obvious abnormalities. There will be obvious fractures, obvious lung opacities, obvious pathologies, not like the former rapid reporting style. Also, if you see their examiner marking guidance or this is an answer uh, uh, requested from the RCR itself to give you example how to answer this kind of cases. So the main findings is the fracture radius and the fracture and you must include the negative data if there is any dislocation or not. The ulna is fractured or not. And if you can find here also, they put the specific diagnosis, not like the rapid reporting style before. No, you must put a specific diagnosis or a specific signs in this new short reporting exam. They mention the type of the fracture, the Salter Harris, which type of them. Also, they give you a good thing that they put another answer examples of answers and how it is average or it is poor quality answer. So if you mentioned, see this answer is very short. It seems like a rapid reporting previous rapid reporting answer styles. No, they don't want it, and they put it as poor. You mentioned that the abnormality is like that, and that's it. I will refer it. See here, but here the answer is a little bit lengthy or longer. It includes more information, but it is average. It is average, and it is not the optimum. They want you to put short sentences, direct sentences about the direct abnormalities. if there is any important negative related to this abnormality, and the specific diagnosis. Here he didn't include the Salter-Harris in the answer. So it is not about how much you are writing. No, it is how accurate you are writing. So here he wrote more in the answer, but he didn't get the mark that the full mark or the mark that he deserved it. Another example is for the chest X-ray. You will, I think, at least you will get 9 or 10 X-rays, chest X-rays in the exam. So you must practice and learn the chest X-ray very well. There is also a very good book about the chest X-ray, is named the Chest X-ray Survival Guide, and it is around 200 pages for chest X-ray only. But it deserves it, because half of the short reporting exam will be chest X-rays. So you must master this part. Here you can see the abnormality is retrocardiac triangular opacity there, and there is missing of the medial end of the left hemidiaphragm. As important negatives here, you may mention that there is a hilar mass or not, there is pleural effusion or not, the bones, there is any masses, the other lung, how it is normal or not. So it is relevant negative data. You must include it. The next step, you must ask for CT chest, not only referral to the physician, to the requesting physician. See, urgent CT chest with IV contrast, urgent referral. And also, if there is anything urgent, you must put as urgent. You must include in your answer the word urgent. You must highlight it, because some cases like free air, pneumothorax, pneumoperitoneum, if there is a missed tube, nasogastric tube, it is in the right bronchus, or endotracheal tube in one of the bronchi. All of these kind of abnormalities, they are urgent. So you must highlight that they are urgent. And don't forget that. See the answer, it is a little bit lengthy. So 4 or 5 minutes, yeah, it is a little bit better, but you must be fast typing, and you must have also like a scheme that in the chest X-ray, if I found this abnormality, I will include 4 or 5 lines for this kind of abnormalities, including the positive and the negative data. And you must practice it very well, so you are fast in it. You find pleural effusion, what are the answer pattern or the answer scheme I will include in my answer. If you find fracture, how I will answer this kind of cases. So you must prepare very well before the exam, because there is no time to think or to organize your answer during the exam. So please, first you must be good in radiology, then you practice the same exam situation. You practice as many as you can. If you can do 1 exam per day, this is the ideal. 1 exam per day. I know you will not take 2 hours, because you are at home, more relaxing. So sometimes you get bored easily. So I know that, but at least you answer 1 exam per day, in the long and in the short. And again, you must have a short notes for your own, a written notes, or you put it in a Word file on your laptop, and you put in the abnormalities, like the lungs. When I saw pneumothorax, this is my answer. It will be 1, 2, 3, 4. And the next step will be like that. If I saw pneumonia, this is my answer, 1, 2, 3, 4, and the next step will be like that. So you practice, you are actively preparing to the exam. You don't only watching videos or looking by your eyes only through the images. No, you must actively preparing to the exam. And if you did this part before the exam will be easier for you. So you must like if you get relaxed now, you will give yourself a harder time in the exam. If you give yourself a harder time now in preparation, you will be relaxed in the exam. It is like that. So choose whatever you want to do. I think this is more than enough for you. There is a lot of examples in the website. You can go through them by yourself. Please first read what is the changes, know what are the changes, what they need from you, and then start from there. Don't practice on your own without asking or without knowing what is requested from you and what is the model answer that you should provide, and then you should start from there. And let's keep in touch in the Telegram group and in any other means. If you have any questions, you can post it in the group and we can discuss it freely. And that's it from my side. I hope you enjoyed the rest of the session with Dr. Amin and Dr. Rizq. And I'm so happy to be with you again. Thanks for joining us.
Thank you, Dr.
I hope you the
Mahmoud, for
best.
your time. Thank you.
Yeah, thank you.
Okay, thank you for this amazing illustration of this new style. For my side, this changes that Dr. Mahmoud Saidi discussed about you, I will illustrate it to you to just understand the new system, the new situation, the bus scoring, how this scoring system will work, and how this will impact your preparation. In fact, so I'll start sharing my screen again, okay, with you. Then we can start. You can see my screen. Okay. So this is the CR2b changes. Okay, so what happened? We still have the three components of the exam the same way. But the major change here now, before we have rapid and long and two rooms of oral exams. So we have four exams. If you four parts of the exam, you have four parts. You have marks in 4 parts, so or 4 stations, and then you have to pass into and get score of total of 24, like this one. Okay, because there's a lot of colleagues already joining the exam second time, so there is a change in their there is a history with them. They are joining the exam before. So what happened? They make a short exam instead of rapid reporting style, and this is one of the reporting exams, and long reporting exam, and oral component. So the oral component now is one component. They will mark it overall. You will get an overall mark for oral exam, not 2 rooms separately. Now it's 1 room. So all components will are to be taken in the same setting. All this information from the Royal College of website. So I just try to make it simplified to allow you to know what is going on. That means that you are going to take it in the same setting, meaning that you are going to take it in the same setting, not like physics and anatomy. You can take physics in one set and anatomy in one set. No, now you are the same way before. You will have the reporting component in one day, and you'll have your viva or oral component in another day. Then that's meaning what they mean by the same setting. This very important issue here regarding the type and level of content. It's same, no changes. So just calm down. There is no major changes in the content itself. Okay, the same level of cases, the same level of preparation. You are expected to prepare with. Okay, so don't worry about it. In fact, it's most of the changes in the background. It's not in your but if you know the background, you are going to prepare yourself well, because some of these changes are going to make difference in your preparation. Okay, so the reporting exam in the first day, we have long reporting exam, 6 cases in 75 minutes. The changes in this long reporting is in the scoring system. This long reporting is the same, without any changes in your interface. You are going to report 6 cases, but they changed the scoring system, as Dr. Saeed discussed with you. So you need to read this text about the scoring, and I will discuss the scoring in details regarding the scheme of scoring and how they are going to score it. Okay. And you have totally new short reporting exam, which is 25 X-ray, which is abnormal cases in 2 hours. And this is very important change, because a lot of colleagues are suffering from the rapid reporting style. Most of colleagues are telling this is not real, not reflecting the routine and the daily practice. So I think it will be more easy from one side and more harder from another side, because there is a reporting now. The challenge is how to be fast, as Dr. Saidi in your I hope you are hearing me well, because you can hear me. Just write in the chat if you can hear me. Can hear me well, please? Okay. Yeah, thank you. So the totally short reporting and long reporting exams, they are going to, you have a challenge of time to report the case in this time, because there is a trick in the exams of long reporting, and I expect this in short reporting as well. They are going to put a cases that will take time in reporting. So if you are not prepared and trained to report quickly with good phrasing, I mean it's a bullet, but including all the informations. It's short statements, but including all the information needed in this one. You have a checklist that you are following, as Dr. Saeed discussed with you. So this is very important, and this is the challenge, in fact. And another challenge is that it will be longer in the duration. That you have now 3 hours of examination or 3.5 hours of examination. Before it was only 2 hours. Now you have more effort will be in the exam day. So this will need you to prepare well, because you are, if you are not prepared, you can lose your concentration during this long time of and a lot of images you are seeing and you are practicing. So practice is very important in this scenario. Okay, so this is the first reporting day. The second day, the oral exam, the changes happen now in the structure, in the structure outside, but in the background, as I told you, the content is still the same. So you are expecting the same level of the cases in the oral and viva, but there is a very good, from my opinion, a very good changes that will allow fair and very accurate measurement of the of each candidate. So it will be very nice. So we have 2 stations in another day. You will be in 2 stations. Each station is having 30 minutes, like before. 2 examiners in each room. That means 1 hour of exam with 4 examiners. What will be the changes? The changes that they are going to fix the number of cases. They are going to have a bank of questions that will be reviewed and published by the Royal College for the examiners. They are going to test the colleagues regarding the packets. So the same packet, the candidates are going to be examined in long reporting. The same packets they are going to examined in short reporting, and each day of viva they will have the same each day. Each separate day will have the similar packet to be examined. This packet is 12 cases in total. So you have in each room 6 cases to practice per oral session per station. That means that roughly each examiner is going to test you in 15 minutes 3 cases. That's the overall of the examination. So you have 12 cases along the 1 hour. Okay, so this very important one, the level, type of content used within the oral component will remain the same. So don't worry about this area. So this up to now, this is in your favor, because a lot of issues before regarding how depends on each examiner and his way of testing, his way of collecting the cases. Some are collecting very hard cases and others are collecting easy cases. So it depends on your luck. Now it's fixed. All colleagues are going to be tested in the same level. So this is very important. The decision that you are going to be tested in the same day means that you'll be in the room. You are not going to communicate. You'll be in the quarantine until they ensure that there is no one is meeting and people not meeting each other. So this is will be they will discuss this how it will be and the process how it will be, and this may affect your booking for travel and these things. So be aware before your booking of any travel. A lot of colleagues are going to book their flights after the examination. So this may affect your book. So take care about this point. And I think they are going to make more clarification about the process, how they are going to hold the colleagues and prevent colleagues to meet each other because the same cases will be in the same day. Okay. So this is very important. So we are going now to discuss the overall scoring. What will I do to pass the exam? What is the criteria? The problem now, it's more complicated, and it's not like before. It's clear. Okay, it's depending on a lot of equations and methods they are using in the background. So you need to, if you passed all the 3 components already, you are going to pass the exam. If you fail 2 or more, yeah, this is equal failure. But if you pass 2 and fail 1, so you will wait and see. They are going to make this will depend on which component you passed and which component you failed. If the candidate failed one of the reporting sessions, or reporting exam, and they pass the oral and one reporting, suppose that you passed short reporting and you passed the long reporting, the oral stations, and you failed the long reporting, they will look to your score in the long reporting. If you passed the measurements, they are making some standardization, and they are going, if you pass the standardization they are putting, then you are going to pass this. This is one standard error of measurement. This is complicated. I tried hardly to know, and I think they will explain this more in the future to be more clarified, because there is no abundant information about this, how they are going to collect this one. In fact, it's not clear. If you you failed the oral exam, but you passed the long and reporting, they are going to use a half standard error of measurement, that's SEM1. In fact, I don't know what does this mean. So we will wait and see, and we can ask them. They are going to hold to make a session for questions. The Royal College, I think 1 May, the 1st of May, they are going to make a live question and answer session. And I think this will be important to be aware about what is the problems and what is we can make our questions to ask them and clarify any issue that not clear in the website and or in the provided information. All this information from the website that Dr. Saidi shared with you now. Okay, so let's go to the scoring system of each part. Okay, we will take know what is the changes that will happen in the background and how this will affect your preparation. So in long reporting exam, that is 6 cases. Each case of them will be marked from 5. This is the main the maximum score that you get, from 0 to 5. 0 to 5, each one, 0, 1, 2, 3, 4. There is a specific requirement for or a specific description for this one. You can review it, and I advise you all to read this carefully. Print it out and read it carefully. Study it, because it's very important. This will affect your preparation markedly. Okay, so you have 6 cases. Each one, maximum you can get in each case 5 marks. this will be total 30 marks. Each candidate will be, each paper of you or each exam, each candidate will be, 2 examiners are going to mark his answers, your answers independently. Everyone is going to mark it away from the other one, and then they are going to compare it. And they will take an average between them. And if there is any question that there is a score difference of 2 or more, they can allow 1 mark difference between one. One can give you 4 and one can give you 5 from his point of view. But if one give you 5 and one give you 2 in the question, they are going to flag this one and really review it again and discuss it again together. And then you are going to take the mark depending on this discussion. Any questions, all questions include questions specific marking guidance that as Dr. Saidi showed you, they are going to put a guidance for the examiner to follow it, which important positive that will take marks, which important negative that will not take marks. Each component of this differential diagnosis, if you write the diagnosis in there is a guidance for them, for key findings, for diagnosis, for recommended management. So all things are in front of the examiner. So they are going to mark this depending on a guidance, a specific marking guidance provided by the Royal College itself. They are going to use the same method of who will pass the exam. So I got 25 in the long reporting. I passed or not. I got 22 from 30. I'm going to pass long reporting or not. This is not clear. This will be depending on each setting, like 2A examination, like physics. It depends on this angle of standard setting process. This one I highlighted it. Okay, this is the same way like in 2A. One set you find that in 2A the pass mark is 170. In another set you will find it 165, and so on, depending on the participant, the difficulty of the questions, depending on the. So this is good because this will be an average from all colleagues. So this will depend on the difficulty because we all suffer from this one, because we have sometimes a very tough examination in long reporting especially, and I think this will be reflected also in short reporting because the same process will be there. So I think this is very good because this will reflect the average of the colleagues, and this will allow who prepared well, who practiced well to pass easily in this with this system. Okay, from my opinion, and we will see in the future. Okay, let's move to another slide. In the short reporting, the same process but with different depending on the question. 25 cases, 5 marks per case, so you have total 125 marks across the exam. Okay, the same. 2 examiners are going to mark your answer sheet, and they are going to take the average, and the same way if there is more than two marks difference, they are going to flag it and review, and all the questions are also have a guidance of the findings, diagnosis, recommend. Like on the website, you saw it. Dr. Saidi showed you the example of the college is going to give to the examiner to follow it during their evaluation of the answers of the colleagues. And the same process of the angle of one is going to be the standard way to measure the pass score in each sitting. So it will depend on each sitting. There is no you got 6 marks in this room, so you pass. Not like before. It will depend on the colleagues and each sitting situation. Okay, So now to the major changes, in fact, in the preparation of and in major changes, in fact, is in the oral exam one. And this is very important and reflecting how they know that the previous one was totally unfair, in fact. This one is more systematic, will allow the colleagues who prepared well, who already know the things and have all the items that they put from long time in the exam criteria to fulfill this criteria. So before it was a total subjective. It depends on the examiner. If you did an unsafe case in the whole room, you are going to lose the whole room. It's totally unfair. I can miss, everyone can miss anything with the stress, with the exhaustion, with the, you can miss easy. So why you are going to make this? I did 10 cases along the 30 minutes with the two examiners, and then in the last case I missed something because of time, because of the exhaustion. I got some error with the system, with the scrolling, whatever. Okay, why I would going to take 4 marks or 4.5 in the whole room? Okay, so it was a very, very bad issue. I think this is now more fair, more real, because before also there is no standardization for how many cases I'm going to take inside the room. Okay, now everything is structured, and the most important one is the bank of questions. This is very important one because they are going to make it and reviewed by a lot of colleagues, consultants. They are going to put a standardized cases for the exam testing, which is very important to allow a good evaluation of the candidates. So there is no extremes. This will be definitely ensured inside. Will be hard cases, like in long reporting, there is hard cases. In short examination will be hard cases. In the Viva will be hard cases, but impossible cases, it will not be there. So don't worry. I think this is very, very important. So we have two 30-minute oral stations like before. At each station, candidates will be presented with 6 cases in each station. So you have 6 cases in 30 minutes, means roughly each case will take 5 minutes. So I think this, and I have a question here, and I will try to get an answer in the coming days about this one. What is the meaning of case? The case is single X-ray, or the case is a complete case? That means that I have an X-ray and then CT scan and then maybe MRI. I have ultrasound and CT scan, and I have an X-ray then MRI. What's the meaning of the case? A case, is it a film or is it a whole case? Because this is very important and will make a difference in the preparation as well. There are 2 examiners present at each station, and each case will be independently marked by both examiners. So they are going to put the case. I'm going to ask you about the case, and we are going to put double marks. So 2 scores per case. 2 scores per case. So these scores from all examiners across both stations are then to give the candidate's total score out of maximum of 480. That means in each room you will have 240. Okay, and then each examiner is going to give you a total score of 120. Then you have 6 cases, so each case will have 20 marks per examiner. So each case will have 40 marks. I think everything is clear. So now this marking framework, they are going to independently mark your answer. Any difference more than 5 marks between the examiner, will be flagged and reviewed, and discussion will happen depending on this. Suppose that in one case, one examiner gave you 15 and the other examiner is giving you 9. In the same case, there is a difference more than 5 marks in this case. So they are going to give you, they are going to flag this case and review it and discuss what happened in the room between you and the examiner, and this will affect your performance. Okay, complete case. Yes, thank you for this information. Maybe I missed this when I saw the video. So this is a complete case. So this, thank you for this your guidance. Thank you very much. I don't know. In fact, it will be recorded or not. But maybe this discussion will be after you leave the room. If there is any difference, it be I don't know. This can be, but maybe we can ask this. So you have a pass mark of 280, more than 280 to pass the whole Viva examination or whole oral examination. Okay. So they didn't mention this in the written articles, and I go quickly in the video because this video is recently added. So I will review the video, and if any new information not presented in this discussion, I will let it published in our Telegram group. So don't worry about it. So now we need to focus on what is the changes in this one, because this will affect your preparation for Viva very importantly. Before in our courses, we are concentrating in all these aspects. In fact, we believe that you are not going to generate a good Viva case without hitting all these criteria. So this is because this is in the background, it's very important. And you need a long time of preparation. In fact, believe me, this Viva needs a background in your mind, in the mindset, how to manage this knowledge and this your experience in and your eye tool. You are using your eyes and your experience to look to the films, and your knowledge how to mix this with the clinical data and be safe and give a good management. How to make this they are going to make this very very clear now. If they are going to test you in all these things, you need to show yourself in this all domains, radiology knowledge, okay, and observation, clinical reasoning, how to connect the clinical data provided or about this situation with the knowledge and with the observation, and how to be if there is any safety or management in this case, you are going to show your ability to take this case to a next level of management. You are the one, and this is very important one. So, and the communication score, there is a communication score will be added to the new system, and this will be marked in the per station. So each examiner is going to evaluate your communication skills inside the room. So this is not it's an important issue to work on this communication skills, because we have a lot of problems with this one. So we need to figure this out, because this will take a lot of marks. In fact, let's discuss these marks. So we have 5 domains in each case. 5 domains. 4 domains will be managed in each case, and 1 domain will be managed per station. So we have the first 4 will be in each case, and the last one, the communication one, is going to be per station. Okay, so you'll have a overall score between the 2 examiners per the station. Okay, so now we are going to hit this is between. So we have in each domain, we have 5 scores. We have fail, between excellent and fail. Okay, and this excellent, clear pass, just pass, borderline fail will be represented by marks. Okay, just sorry, just be with me in this issue because it's very important. Now we have in each domain, like knowledge, we are going to test your knowledge. In the case, you are going to show us your knowledge in this case. Suppose you are provided by a slipped capital femoral epiphysis film. Okay, so you are going to show us you already have the slippage, okay? But in one side, the other side is not obvious. You are going to show us that you are aware about the criteria of making this diagnosis by the observation. You know there is a specific line will be there to you are going showing us your ability to describe the criteria of this disease. There is a slippage, and this is representing Salter-Harris fracture 1 type 1, and this is maybe associated with complications. You are giving this as a negative with avascular necrosis. You are talking about the percentage of the bilaterality. So you are going to ask for another film or another examination to be sure there is no bilaterality in this film, like frog leg position or MRI study, whatever in the scenario of the case. So in this situation, you are going to test the knowledge one. It's virtual. If you mean by virtual on a platform, yes, it will be recorded in the like in the same scenario now. It will not be in the same room with the examiner. You are be online. So between fail and excellent, we have the 5 scores. Fail will be represented by 0. Okay. Let us use the laser pointer. Okay, sorry. Okay, so you have 0 in this one. Unfortunately, if you are failed any of this domain, you failed to represent any knowledge. You failed to catch the abnormality observation. You failed to connect the clinical data with this case. You missed the measurements of you missed the you talked about malpositioned line, and you didn't talk about urgency of this, and you need to remove this or make another one, whatever the issue. Okay, so between 0, which is fail, borderline fail 1, be represented by 1 mark, just passed by 2 marks, clear pass by 3 marks, and excellent by 4 marks. And here is a displaying the features of each domain. How to, if we take an example of clear pass, you need to display positive domain characteristics. The domain characteristics mean you need to describe the main knowledge items in this case. You need to describe the main key findings and describe the main irrelevant findings in the observations, and so on. Some minor negative characteristics are displayed. Competency is clear, demonstrated. So you are competent, you are clear, you are describing everything with a very good manner. Okay, and the same way of preparation is there, but you need to be focused that you need to hit the knowledge, not waiting for the examiner to ask you a supplementary questions. The examiner will do it because he is going to test you in 5 minutes. So some cases, I think it will not take 5 minutes. So he's going to ask you to fulfill the criteria. Then in each case, the examiner who is talking with you, discussing the case with you, is going to report to mark you with this one. In knowledge, you got excellent. Okay. And in observation, in the same case, you clear pass. In the clinical reasoning, you're getting just pass. In clinical safety and management, you are getting borderline fail. So how we will be? So we are going to use it to reflect this in numbers. 4, 3, 2, 1. Okay. So you are having an overall score in this case. Now we have maximum here 4, maximum 4, maximum 4, maximum 4. Okay, so equal 16 in each case. Okay, and remember that there is a communication 1. It will be in the last one. Okay, so this will be per station. So in each case, you are going to have a mark of 16, and in this case, you got 10. Oh my God, 10 from 16. Okay, the other examiner is going to mark the same one. He is going to give you in this one. He is No, he is going to give you borderline fail. So you with the other examiner, you are getting 9. Okay, so totally in this case, you got 19 from 32. Two examiners, they are going to make the same marking in each case. Okay, so suppose the first examiner is going to take the first three cases, the other one is going to take the other 3 cases, and so on. So after this, you are going to have a total mark of communication skills. So in this one, you have with the examiner, in the whole station, you are going to have a clear pass. Clear pass means each examiner is going to give you give you a mark. One is going to give you excellent, one is going to give you clear pass. Clear pass 3 multiply 6, then you have 18. I'm good in math. Okay, this one will need a very talented examiners with math. Okay, so we have now 18 marks in the whole room in one examiner. Another one is going to give you maybe excellent. So you have 4 multiply 6. You are have 32 in his part, and so on. Okay, so we are going to have this one. So this is a scoring system. You need, as we told, to collect from the whole oral examination 280, more than 281, to pass the oral stations, both stations together. Okay, it's not separated anymore. Okay, so I think this is now obviously clear about this one. So I will go through this one. So to illustrate this, start early as you can. Start early as you can. This will need more effort. We all hope this will be more fair and more accurate in the evaluation, because a lot of people suffered from this unfairness and some silly things during their examinations. Okay, all new systems will need time to be fixed and mature, and you will need a lot of time to be familiar with it. But in the same way, the people is going to take the risks also by joining the exam early, because every system need to success. So there may be some excuses for new colleagues who are going to take the examination in the first sittings. For colleagues who had history with the exam, the old system before, don't worry, no worries, because most of things are in the background. In fact, it will not now the changes in oral examination, for example, it's in your favor, because now everything is clear. You know what is your, but you need to fix your preparation to meet all the criteria. I have a problem with communication skills. Please work on this. Start working on this. This will take time. I need to speak loudly. I need to speak more. I need to practice Viva more. This not totally. You know now how many marks on communication skills in the exam is very huge number. Okay, so you need to communicate well with the examiners. Your voice must be clear. You are having a very nice statements discussing in the discussion with the examiner. You are not terrified. You are not. He's asking me. He's going to ask you, because there is a criteria in the exam to ask you about knowledge. It's not a deep knowledge. We already know that they already asked us and they tested us before in the 2A. So there is no matter of deep knowledge. They are going to ask the relevant knowledge or important knowledge around the case. As I discussed with you, this is a sample or example of slipped capital femoral epiphysis. All of us know the information I told, but you need to show your examiner that you are able to show this knowledge, this information very clearly. So this is very important. For new colleagues joining the exam, I think everything is new. So nothing, maybe you face a problem with the material but because we already know the system, and we already know there is no changes in the exam levels and criteria. In fact, there is no major changes in the criteria, and it's only in the scoring system. So, but the fact or our background of the examination is going to test the same material. So we already in RADME and other colleagues in any place, they provide a lot of things that can help you to overcome. And I think after the June examination, abundant material will be available for each platform. For our platform, radmiradiology.com, and I hope that you all have an account there, because a lot of free material is there for you to support your preparation. You have a free sample of long and short exams on our website, so please try them. We have a same software simulating the exam, and I will tell you that simulating the exam software is very hard from our side. It takes time to make it. Why we make it? Because it's very important, because system inside the room of the examination is taking time from your time. If you are not familiar with the software, I mean the main items of the software, so you are going to lose a lot of time. Okay. Okay, I will share the Telegram group also in the chat. I think we are going to share it. We already established 10 short exams. This is very good news already. I think now on the website already there's 6 exams and 4 exams in the review stage. We are going to put them by maximum by the end. They already just in the final stage of review. We are going to put 10 cases, 10 exams in 25 cases. So you have around 250 cases of short examination with model reporting. We analyzed the sample reporting they provide on the website of the Royal College, and we follow the structure how to make this in the sample examination. So it was very. We followed the RCR of chest to be around 12 cases, and MSK around 12 cases, and 1 case of abdomen, and 25% adults, and 25 around 25 pediatrics. So we tried to make the simulation of the exam to be more reliable for the exam. So it's very important to touch this and use everything in the market to try to practice more and more. Practice is your way to pass the exam. Nothing equal practice. Please believe me. Don't waste time. Don't waste your effort in unnecessary work. Practice rapid, short, practice long, practice viva. This is very important. Okay. Regarding we are going to make a free event also to see the impact of we can make a viva, especially in viva. So we are going to announce this recent as soon as possible. Okay. Regarding people who are asking for CCCM course for June setting, will start 25 April. So book your seat, please. I think Dr. Risk reach the Dr. Risk. You are here. Please let me.
Yes. السلام عليكم.
وعليكم السلام.
طبعا بالعربي سعيد بكم التواجد معاكم النهارده في نيو سيستم.
We have non-Arab colleagues.
Yes, we have non-Arab colleagues. So we are happy and pleased to be together in this session. And as Dr. Muhammad mentioned in the last few words, you have to practice as much as you can. This is the most important. What we try to do just to know that our course is unique in something. Maybe our colleagues know this point, that we try to make like study groups. These study groups, the issue that you need support either from us or from other colleagues. So this was the startup of our idea in our courses, and finally, alhamdulillah, we reached this success rate, the high, one of the most highest success rate Alhamdulillah, we achieved with you, and we are looking to be inshallah more in the new system. I think the new system have a lot of advantages, and one of the best advantages, especially in the short system, that as my colleagues mentioned, that almost all the slides or the answer or the question will be abnormal. This is really a big achievement, because you know, in the old rapid system, you have almost half of this question were normal, and this is the struggle usually, how you can make underestimation or overestimation, and this was very, very tricky in the reality. But since that we inshallah we're starting the new system, I think it will be very beneficial. Just struggle mainly focus on the training, how you can train as much as you can and exercise and make efforts that inshallah you achieve the best result. We will try in the courses either through the free event we do or through the specialized courses we do in M and other courses to focus in the training according to the new system. And we hope inshallah we have higher success rate in the upcoming sessions of the exams. And inshallah ta'ala it will be yani bushra and something we are happy inshallah that it will be nice. I think it will be good, better, and have a good impact inshallah, all of us. Inshallah, we have also, as Dr. Muhammad mentioned, we have a lot of already we put in the README website a lot of exercising modules according to the criteria of the new system. So maybe you can try to, at least at the free one, you can try to check how it will work with you. And if you need anything, that you can leave your feedback to give us some evaluation how it will work with you, either positive feedback or even negative feedback. We are happy to receive everything. Thank you for your attendance, and I'm happy to be with you. And for any questions, if someone need any questions, we can also discuss. Thank you so much.
Thank you, Dr. Rizk, for this nice words. Thank you very much. I also, Dr. Rizk, shared with you the link of the CR2b tips and tricks tips and tricks, and this is very important one. We need you to make it a more active environment. You are the leaders, in fact. If you start to make questions, both cases, we can discuss this together. And also I shared with you the website readmeradiology.com. So if you don't have an account, try the account. I asked the IT team to put the free sampling of the short and long reporting for all colleagues. So all colleagues can test this. And as I told you, if you already, we have now live on the stage, there is 6 exams of short, and 4 of them will be published maybe recently, 2 days, maybe by the end of the week at maximum. This all will be in there. So for colleagues, also just remember that the booking of the October sitting will be in after 2 days, I think 14 April. Because please follow your hub and check it in and update your watch and try to check. I think one of the colleagues told me that this is a few number of seats provided in this sitting also in October. So try hardly to be ready for the booking, because this is very important. Securing your seat is very important, and I know that it's hard. We are trying hardly to discuss with our colleagues, and we'll try to see why they are try from our side to discuss with anyone who is having any why this numbers is not going in Egypt. They are putting only 12 seats in Pakistan, 12 seats in India, 28 seats, and in UK it's few seats. So I don't know what is going on in October as well. Maybe they are going gradually with the new system. So we hope also they can add after June examination a new seats. So be ready for your booking, and I hope everyone enjoyed this session. If you have any questions, you can ask in the chat, or you can discuss anything if you want. Also, anytime you have any question regarding the new system, just share it in our Telegram group. We are going to discuss this together. Thank you all. I hope you enjoyed tonight, and we hope that we give you formative and we make some illustration of this information already provided in the by the Royal College on the website. Just to be discussion will make things more clear, and you can imagine now how you for Viva complete case, H1 X-ray and CT, or X-ray and MRI. It depends on each case. What they mean by complete case, it depends on before they are marking each case, the case before in the previously, each case mean X-ray is going to be marked from 8, CT is going to be marked from 8. Okay, now the new system, they are going to have the complete case as colleagues. So I will review this in the video and also share it with you in the Telegram group to be sure about this. Okay. Any other questions? Okay. Have a nice night, and keep in touch with us on the groups anytime. Thank you very much for attending, and we hope to provide a nice free sessions in future. Just follow us in our groups. Thank you very much, and have a nice night. Thank you.